Hi everyone, my name is Professor Peter Nash from Griffith University in beautiful downtown Brisbane, and I'm reporting for Room Now at the EULAR Conference 2023 in Milan. Today was day one, lots of interesting abstracts, posters and presentations, but the one that caught my eye was the study of Baricitinib in lupus nephritis, OP0053. Now we know the Baricitinib study was a negative study, and the TIC2, or really TIC-JAK4, deucravacitinib, was a positive study. Both had a primary outcome of SRI-4. One was 57%, the other was 58%. But what killed baricitinib and made it a negative study was that the placebo response was 45%, and the result was non-significant. And with deucravacitinib, the placebo response was in the low 30s, and they got a positive result. So hence, baricitinib was not moved forward in the development for lupus. So this was interesting because it was an Egyptian study and quite a small study, but it was phase 3. It was randomized, it was double blind, and they had an active comparator design where they looked at cyclophosphamide in a good strong dose monthly for 6 months and compared that with baricitinib 4 milligrams for the same time. Now they've continued the study out to 12 months. They're reporting the 6-month study here, and the 12-month study will have renal biopsies. The 6-month study did not. Now in previous biopsies, there's lots of JAK expression in the kidney. They had an animal model where the JAK inhibitor was successful in lupus. So let's see what they did. They took grade 3 or grade 4 lupus nephritis patients who had more than 0.5 grams a day proteinuria with cellular casts and a SLEDAI-2K that was elevated. Their primary outcome was change in proteinuria at week 12 and at week 24, and then they multiplicity controlled the secondary outcome measures, which included complements and double-stranded DNA and SLEDAI-2K and changes from the baseline. So they had 30 patients in each arm, not a big study. 58% had grade 3 nephritis, the rest grade 4. They were youngish, 32 years, they were all females. Their baseline SLEDAI-2K was 7, so they had good active disease. And at 12 weeks, there was significant reduction in proteinuria, 70% for the baricitinib group, 43% for the cyclophosphamide group. Similarly, the secondary endpoints like C3 and SLEDAI-2K was in favour of baricitinib over cyclophosphamide. They did exclude patients who were antiphospholipid antibody positive or had a history of VTE. And on the safety side, adverse events were comparable, 48 and 46%. 2 patients on baricitinib had a serious adverse event that led to discontinuation, and 1 patient on cyclophosphamide had a similar serious adverse event that led to discontinuation, and this was a serious infection and a zoster. So they were able to show in a comparator trial significant benefit of baricitinib compared to cyclophosphamide. I should have added that all patients started with methylpred and they had a forced steroid reduction over a number of weeks down to 5 milligrams a day. A very interesting result, hypothesis generating, needs to be repeated, bigger numbers in other countries and longer term follow-up, but a clue that JAK1/2 inhibition with baricitinib 4 milligrams might be a valuable treatment for lupus nephritis in these patients who had active disease when you compare it in an active comparator, not powered for head-to-head, with intravenous monthly cyclophosphamide. A very interesting study. Hope you enjoyed that and look forward to reporting more interesting studies from EULAR 2023 for Room Now in beautiful Milan. Thanks a lot.